This podcast is for a mature audience and may be viewed as inappropriate or insensitive to some. Listener discretion is advised. The intention is to share conversation of like and unlike-minded individuals as they try to be the best them they can be in a life full of challenges, searching for love, acceptance, and positivity. Call 669-241-1422 and share yourself or catch up with Sweet Baby J for an anonymous face-to-face interview. Feel free to call in with questions, stories, thoughts, or anything you would love to talk about and share. Nothing is off the table when talking sweet with Sweet Baby J at 669-241-1422.
Ladies and gents and ladies, once again, you are here talking sweet with the one and only Sweet Baby J. As always, a no face, no case scenario. Today we are honored to have this young stallion, very accomplished young man. Sir, what do you do for a living?
I'm actually a urologist. I'm trying to cover up my voice. No. I'm a surgeon. Yeah. And I guess I'm supposed to be incognito here, but yeah, I'm a surgeon.
Bro, that covering up the voice sounds sort of first 48-ish. Oh man, so I'm
a surgeon of the balls. Surgeon of the balls. That's what I do.
A testicular surgeon, huh?
Something like that.
So, you wow. Now, what made you choose to be a urologist of all things that you could have done?
You know, I always wanted to be a doctor. If I didn't, my mom would have probably kicked me out of the house. But once I got into med school, I had many different career choices, and what I'm doing now wasn't actually even my main career choice. I just did it for a week just to pass some time. I needed a rotation within a rotation, and then I fell in love with it. I loved the technology, the people, the personalities, the body parts that we deal with. I loved being able to help men and women, all different age groups, and it was love at first sight. And that was it. The rest is history.
I was going to say, so you fell in love with the testicles. Is that what you're saying?
I fell in love with urology.
Oh.
What it encompasses is up for interpretation.
You do males and females, correct?
The way you asked that question is a little bit interesting.
Do you?
I see male and female and non-biased and non-gender patients. Yes, oh. I see all comers.
Oh, that's pretty dope. In your journey of becoming a doctor, we're not going to say have you ever cheated on a test, but have you seen any of your fellow colleagues cheat on tests, and what was the result of that if they ever got caught?
I've never seen it done. It's kind of hard in this day of an age of standardized testing, and I can't really say what happened to these individuals. I guess they made it, and they're struggling now because they would have cheated, or they made it and got away with it. But I'm not here to judge, man. My time is my time. So,
exactly.
When out there at the gates of whichever heaven you choose to believe in, we will all have that day that we're judged. So
true that.
Each their own.
Exactly. It's funny and not so funny at the same time. I personally had a procedure done by a urologist in which I had the Resume procedure for an enlarged prostate. So the reason why I wanted to speak with you is because I personally feel that a lot of men suffer in silence or are not as verbal about men's health issues as I think women are. Would you agree with that?
It's absolutely true. That's why men live 5 years less than women. And that statistic has continued on. The gap is just actually staying the same or even widening. So it's what you're saying is actually research proven. You and I are going to live 5 years less than our female counterparts. For sure.
I really thought it was because men just got so miserable that they was like, yo, I'm out.
No. But all jokes aside, mental health is actually a huge killer of men as well. Men are more likely to think about suicide and actually complete it. Men are actually more likely to have issues with substance abuse and drinking and excessive high-risk behaviors. So you say it as a joke, but it's actually true. But that's not what men don't do it on purpose. It's a part of their mental health process.
So the thing about that is usually when we hear issues of self-care or mental health or mental awareness, it's usually said by women or it's usually geared towards women. And I think that men often are put in the back burner for these type of things. I
would say you're wrong on that one. I think the messages are for men and women. It's just women are more likely to listen. Women are more likely to engage. Women are more likely to take what they hear and put the changes into action. Not only that, women are more likely to help each other out, form unions, and take those unions to get better health. You know, you see like breast cancer walks so much more openly done out there, and awareness for things like breast cancer or cancers that affect women. That's because women are more likely to support each other, and women are more likely to go and help each other out with causes. Whereas, you know, you don't see you and I kind of rallying towards prostate cancer awareness or better flow in the urine.
Yeah.
It's just not something guys do. You know, it's not what we talk about. We'd much rather talk about the Super Bowl than our prostate health or cancer screenings that we need done.
Yeah, I definitely agree. So my thing is that I had an enlarged prostate, and I went in, I just got checked, and I was offered different options as to what procedure that I can choose. And I think one was, it was like a staple. I forgot what, a TERP?
Well, there's many different procedures. I mean, when you have enlarged prostate, it can either be managed with diet changes and weight loss. It can be managed with medications that relax your prostate or medications that shrink your prostate. And then there's procedures. And the procedure that you had done is a steam procedure, where it's a very quick 5-minute procedure that's done in the office or in the operating room setting, where they kind of put little needles in your prostate. The prostate kind of shrinks over time where the needle went through with the steam. Then you mentioned the staple. It's not staples. It's actually known as a prostate lift. And that's where little anchors are put inside your prostate to open up like the drapes. It kind of keeps the inner lining open. It's kind of like, I tell my patients, like a tummy tuck for your prostate internally. And then you mentioned the Roto-Roo. That's actually where we go in and shave the prostate from the inside, kind of mold it surgically to look like what it did when you were probably half your age. And there's some really cool new things out there too. There's like a little stent procedure called iTind, where you put this little stent in and it opens things up. And then there's something called aquablation, where they use water vapor to kind of remove the inside of the prostate. There's tons of things out there to be done for your enlarged prostate. It's all great, but dudes only care about one thing when they're thinking about prostate stuff, and that's, is it going to affect my sex life?
Yeah.
So a lot of decisions we make are based on what the dude's worried about, and also what you're a candidate for, because not everyone's a candidate for all these procedures. It all just depends on what's going on the inside.
How do you determine what someone's a candidate for and what they're not a candidate for?
Well, it starts off with the basics, history in the office, a physical exam, and most of our patients will get some kind of imaging of the prostate, an ultrasound of the prostate, and we'll actually take a look inside the penis. And that's where we put a little camera inside and look at what the prostate looks like on the inside. And based on what it looks like, then we'll decide what the best procedure is for you, because your prostate just be small, yet it's causing problems. It could have love handles where it kind of starts growing into the bladder. It could have 2 love handles, 3 love handles. And based on how big it is, what the size it is, how much of it's extending into the bladder, then a recommendation can be made. But honestly, some of what we recommend based on what I, as a surgeon, I'm comfortable doing and what I've seen good outcomes in. So there can definitely be some personal preferences incorporated in there, with the end goal being getting you to flow better. Your
preferences also comes, I can only imagine, from how you were trained and what, as well as what you're comfortable with.
And that is the ideal scenario, absolutely. But sometimes preferences can be, hey, there's something new out there and want to see if it gets us the same outcome. The research says that sometimes preferences can be because a patient comes in and that's what he wants. He got some mailer or saw some news, and that's the only thing he's going to do. So either I do it or he's going to go somewhere else. But honestly, a lot of these procedures are very easy to learn. So it doesn't really matter where you go. So a lot of the internal biases are kind of gone when we're doing them. But I think it's important for you, if you're a patient, to, first, you're scared to get in there. That's the first thing. But when you're in there and there's all these procedures, there's no harm. And it's kind of a little secret here. There's no harm in asking your surgeon, hey, buddy, how many of these have you done? Because sometimes when we do a lot of things, we're a little bit better at it than just something that we're doing new. So, you know, if you're nervous or scared, but if you don't care, then you don't care, don't ask. But if you're always kind of like, one of those things where if it matters to you, it's worth asking. Because at the end of the day, man, it's your body.
A lot of men, as you said, are very concerned about how these procedures are going to impact their sex lives. And at the same time, a lot of women are concerned on how the procedures that the men have are going to impact their sex lives. And I bring this up, walking into the situation of birth control. A lot of men put that onus, I think, on women. Like, you know, you have to have a procedure so in order for you not to have any more children. But are men as moving forward with getting a vasectomy from your perception, or is it, you know, like...
Oh, absolutely, man. I've seen 6 patients just in the past 2 days that came and saw me for vasectomy consults. I think the pandemic, you know, we probably made a lot of babies during the pandemic, and now we're kind of seeing a lot of vasectomies after the pandemic. No, I think dudes, you know, the thing is that people feel like dudes don't want to take ownership of the birth control, but listen, dudes only got one option, right? It's, well, they have options. They have either condoms or withdrawing, which have high failure rates, or procedure-wise, there's vasectomy, whereas women do have a lot more options. So when it comes to kind of branding and awareness and marketing and counters where people get the opportunity to discuss these things, women definitely have a lot more opportunities and places to go. And the other thing is that a lot of the things that women have can be reversed, right? So if they're in birth control or the IUD, whereas a vasectomy is permanent. So, you know, I don't think it's a he or a she thing or pointing fingers thing. I think it's just, you know, once the dude knows that this is an option and they're ready for that option. Because remember, getting a vasectomy is a 2-person thing as well. Like, the couple has to kind of decide that. Yes, it's up to the man at the end of the day. There's a few more complexities involved in it. I think dudes are ready to do it. It's just when they are ready, sometimes they're afraid. Dude, you're going to do what to me in your office? Or I have to do what? So I actually offer patients, you know, I'm kind of like a VIP concierge service sometimes. All right, you want to do it in the office? Good. Okay, no problem. We can do it this way. Okay, we can give you laughing gas in the office. You don't have to remember. Or heck, you want to be put to sleep? All right, I'll put you to sleep. So there's multiple ways to do it. So when I know a guy wants to get a vasectomy, try to make it so that, I think seal the deal is a bad word. I try to make it so that they're 100% comfortable with their decision and then they're ready to move on, because I'm going to give them multiple options and multiple ways to do it.
You can do it with light sedation, this procedure?
Yep, you can do it. In my office, like, I usually do it with laughing gas, so they're kind of sedated. There's ways where it can be done with you fully awake in the office. It's another medication. And that's how majority of these are done.
Wow.
And most dudes do just fine. But I also offer, hey, you want to be put to sleep? No problem. Because the only reason I offer so many things is because I actually specialize in chronic pain. Of the testicles, of the penis, of the prostate, but mostly of the testicles. And about 1% of men that get vasectomies can have some chronic lifelong issues. And sometimes they know before they sign up for it, sometimes they don't. So on my website, you probably won't even see that I do vasectomies. I do them because I got to do it for the community. But I'm the guy that people get sent to or people come to when they have issues after vasectomy. So what I've done is I've kind of learned what kind of personality in a man makes them more prone to have issues afterwards. What was done procedure-wise that makes them more prone to kind of feel pain or congestion or have problems. So I've kind of learned from other people and their encounters and their mistakes, and I kind of try to avoid those as best I can. And that's where I kind of say, all right, man, you want to put to sleep? You don't want to remember the pokes and prods and the pain that you had? Okay, that's fine. It doesn't make me better than the other guys that do vasectomies. It's just I kind of cater to the patient to kind of avoid problems in the future.
Your approach is different. You go deeper than the testicles.
I guess you could say it that way, yes.
Meaning you also cater to the mental aspects of the procedure.
I do, man. Listen, I've had kidney stones myself. I've taken care of so many kidney stones. And when I got my first kidney stone, I'm like, all right, I'm a better surgeon. I'm a better doctor now, because now when you saw me, I'm very gentle with my patients, but now I'm even more gentle with my patients because I felt the pain. And once you feel the pain of what happens during these procedures, once you're actually seeing the bleeding when you pee or having the spasms for your bladder, you're a whole different person, man.
Yeah.
Unfortunately, I can't do that with every procedure in urology. I'm not old enough yet to have some of these procedures, or it definitely has made me, putting myself in their shoes.
Humbling experience.
Tremendously. Yes, absolutely.
As a physician, and you just brought up a really good point. As a physician, we cannot deny the fact that you are also human and you age, you go through issues. Do you find yourself more worried about things, or do you approach things from a more educated standpoint than the regular walking Joe or something like that. But when you feel these pains, are you just like everyone else, or are you like, give me the meds?
Okay, do you want the politically correct answer or just the reality?
The reality.
Listen, I may be a doctor, but I'm a dude, and a dude is still a dude. So I had my stone for like 3-4 years, and I knew it was there. I kind of ignored it until it became a problem. Do as I say, don't do as I do is sometimes kind of like the way we have to work as physicians. But I do actually try to be very proactive with my health. Like if I feel something or see something, I try to get it checked because I try to use my experiences as being a role model for my patients. So right now, I've had so many patients lose weight because they saw me through my weight loss journey. Oh. And with COVID, I've gained like 15 pounds. I've kind of gained some weight back. And so now these patients that I held accountable are now holding me accountable. Like, yo, doc, doesn't seem like you're running, bro. Like, didn't you run a marathon last year? I'm like, yes, I did. So it's pretty cool. It's a very family dynamic. Like,
it's reverse care.
You know, yeah. So now they see my struggles, and it's kind of like they kind of give back. But it only happens if I see them as humans, and then they see me as humans. So I'm not any better than you when you're sitting in that chair. At the end of the day, I'm still a man. I still got a family. I still got my own mental and physical battles. So, you know, I appreciate you letting me take care of you, but I know one day, and so if I treat you like a human, you treat me like a human, and we kind of get healthier together.
It's the truth. You are a busy doc. You know, even getting you here on the phone, it was a little bit, but you are in demand. I would imagine you're a professional, you're in demand. How do you maneuver your practice with your family life, with your wife, your spouse, your kids? How do you juggle that?
You know, I got some really good people surrounding me. I got an awesome team. Like in the office, I have an awesome team all the way from the person smiling at the front desk to the scheduling team, to the manager, to the nurses, to everyone. At home, I got an awesome team too. I got a rock star wife that keeps the balance at home, and I got 3 young kids that really keep me accountable to make sure that I prioritize my first main job, which is to be a father. So there are times that kind of get consumed with work, and then there's also times where I'm consumed with family and I have to kind of put work on the side. So it's a constant battle because I'm a workaholic. I want to be good at everything I do. And what I've come to realize recently is that it's impossible. So I've chosen now in my life to make family that first priority always. And work is there. I love my patients, but if I have to choose at a moment, I'm going to always try to figure out how to get that family thing to be happening first.
Yeah, as I agree with you 1,000%.
We can say all this stuff, but we know it's hard, man. It's not easy,
bro. It is a balance.
We can talk all this all the time.
It is a balance. For working in the medical field, it definitely takes a special person to be the partner of someone that's doing this kind of work. You know, the stresses, because it's impossible not to bring home the stresses or anything. But when you work, is your wife in the medical field?
My wife actually has sacrificed everything she wants to do to stay at home and raise the kids and support the family, man. So
there you go.
She is in the medical field because she's a real healthcare hero, because she keeps this healthcare hero going.
It's the truth.
Hopefully this gets me some points at home.
There you go, bro. Let me tell you something. They say brownie points. I think you got a cake.
I hope so. I know I'm supposed to be anonymous, but if you know who I am, call my wife.
Call my wife. Tell her what I said.
Yeah.
I respect it. I enjoy it, man. Listen, it's crazy, though, just that I'm here talking to you about this because I had the resume procedure. And I went in a little nervous, something I've never done before. And just like you said, any man is going to be very careful about that midsection area. The real trauma came after the procedure for me because I still had to go to work and I was going to work with a catheter in.
Well, that's a decision you made, right? You could have taken off for 5 days. So don't be sitting here and say, oh, we made you go to work. Let me just call you on that. You know, you wanted to go to work and you tried to go to work and you were a man about it. So, of course, you know, let me tell you, every procedure you have, they may say you're not going to need a catheter. You're probably going to have a catheter. And that's the worst part about any procedure for urology. But this is what I tell my patients, is suck it up, man. 3 to 5 days. Imagine if you didn't do this and your bladder failed, like I see so many times in my office, and then you're stuck with the catheter for your whole life. So, exactly. 5 days for something that'll benefit you, hopefully, for 5 decades. is worth it. And there's definitely ways to avoid that trauma. I know you're going to sit here and say, oh, I was a hero, I went to work. You could have stayed at home, drank some water, watched some Netflix, taken it easy, and you would have survived. But obviously, we're dudes are dudes, and we're going to kind of try to overdo it. So.
My situation was that, so I was told that, yeah, you could go to work after. So the next day, I was literally going to go to work. I woke up, I was like, there's no way in hell. And I had no sick time at work. I had none because of, family issues and whatever the case may be. So I had no sick time, and I needed to get paid. So I legit went to work with this catheter. You know the scooter that you use when you injure your ankle or whatever?
Yeah.
I was using that, man, because walking with this catheter in is no joke. But that wasn't even it. One night I woke up with an erection with this catheter in. Wow, that was not cool. Not cool at all.
Yeah, man, because the catheter is one size fits all, and it probably was too small for you. Wink, wink. It's like that welcome to Jamaica man joke,
Hey,
so,
hey, no brownie points for me, bro.
Yeah.
No, but it was really painful, and the whole process of walking around with this thing was painful. And then when they took the catheter out, urinating, it just felt weird. It felt like a toilet was clogged. And I felt this like gurgling feeling.
Well, with that procedure, you're going to have that for 2-3 months. But listen, you're talking all about men's health, and now you're scaring them with vivid memories of this catheter. So I suggest to change the topic of the conversation, because it's really not that bad. I've done hundreds of these procedures. Every dude complains like you are right now.
That's my point. That is my point right there. The fact that I went through this, it was a little painful up front. Let me just say this. It wasn't painful. It was uncomfortable. It definitely was not painful. It was uncomfortable and awkward. But after that, nothing whatsoever. The procedure worked out perfect. I feel great. No issues whatsoever. So all the concerns that I had up front, like everything else, once healed, it's as if it never happened. I just feel better.
That's good.
I would love to give the doctor that took care of me a shout out, but here on Talkin Sweet, we like to keep it anonymous.
Well, that doctor was offered you this interview, and that doctor referred you to me, and now I'm doing this interview. So, I'm helping a brother out here.
There you go. You guys have a great team. And on top of that, not just the fact that you guys do strong work, but the personalities. I must say, I was very pleased with the personalities that I interacted with in the office. Gotta say
Wait,
that.
so are you saying me and your other doctor have the same personality? Because I may take that as an insult here.
No,
Yeah,
I'm saying
I like to think I'm the best. I like to think I'm the best. No, I'm just kidding. No.
I was saying, no, you guys both have great personalities. Yeah.
No, I think, honestly, man, where I work, I don't even think about it as work. We have such a good team dynamic. At least the people I work with, it's like all of us surgeons are cooperating, and okay, you do this, you do that, you're better at this, I'm better at this, et cetera, et cetera. And, I think the workplace environment is very important. So I think wherever you go to get your health care, go where you just feel at home. Even if it's you come see me, you're going to have to wait probably half an hour, 45 minutes. I'm always running behind because I like to chat with my patients. So don't let the wait time or the paperwork kind of get in the way of your personal satisfaction. Go and find a place that you gel with. And those are very easy to find. But oftentimes we just go in with this stuffy head and all these frustrations to begin with that kind of jog our ability to kind of feel that vibe.
I was watching one of my favorite shows there. I think it's very funny, Curb Your Enthusiasm. And Larry David, I think it was his dentist, I'm not sure what it was, but a doctor, gave him their personal number, and he would call at some ungodly hours. Do you give out your personal number to patients?
There are some patients that have my number. It's very rare. I actually find when I give them my number, they call less.
Ah.
It's kind of, it's actually, they just feel like, all right, I got someone. But I'm actually very easy to contact. If you go through our website, there's an email place. Now in our healthcare system, we have this electronic medical record where you can message anyone on the team, including myself, so you can send us messages. So getting kind of in touch with us has actually gone a lot easier. But the thing is, people don't want to figure it out. People don't want to log into a website. People don't want to download the app and then 2 clicks to get to us. They'd much rather just wait on the phone. It's kind of like in this day and age when you have to change an airline or something, you don't wait on the phone for 7 hours. You can't just go online and do it. But you gotta be okay you have to embrace that technology, which I don't think a lot of people do as much as they could.
Yeah. So do you find that the advances in technology has made your job easier with your
Well, since this is anonymous, I can be honest, it has made my job easier, but it's also added new complexities to me. Like, everyone having access to me, that's then messages that I have to kind of respond to promptly. If you did a procedure or whatnot, or had some pathology, you would get an alert before I do. So patients actually see results like CAT scans and biopsies before I do. So it's kind of like, sometimes technology is great because information gets dispersed instantly, but at the same time, it could breed anxiety and other things where I don't get to review it. I can't be the person telling you. So technology has advanced us, but it's also kind of added some complexities, which then I have to kind of navigate through and evolve with. And I've actually embraced technology, so I evolve pretty quickly, so I don't get as burnt out as my colleague may, that is not really, barely knows how to use an iPhone and then now has to kind of embrace this other technology, so.
How do you?
I'm not talking about your surgeon. I'm talking about colleagues in general. So
look, hey, listen, I can even tell you, I called him because once I had the procedure after my follow-up visits and everything was good. I'm like, what am I calling him for? It's like, I'm good.
Yeah.
But do you find yourself with colleagues that may be older than you or more seasoned in your fields? Do you find yourself having to help them more, or colleagues that are less seasoned than you, that they're just different? Do you see much changes in the field over the years?
I think embracing technology and change is maybe a little bit harder for some of the season, but I actually see like young guns coming out that also have issues with the technology. But I think seasoned also has its advantages, like surgically, experience wise, and kind of being able to manage complications. So there's pros and cons to all. I think urologists as a whole love technology. We were one of the first to start using robots to do procedures. You see all the different cool new procedures for something like what you went through. So I think as a specialty overall, I see less of it because we're actually we're urologists, and most of us do love technology and embracing it pretty quickly. So we're early adopters in many things.
There you go. How would you say, or what would you personally say is a way to bring men's health more to the front line, and how men can actually speak about these issues more openly?
I've spent my entire career trying to figure this out. And what I've realized is I was trying to change the world with some of our things that we did with all these campaigns. And we did get other people to start talking about it through our efforts. But it's going to be hard, man. Men are afraid of the doctor. They're afraid of what's going to happen. We've done research and surveys where they're afraid of the physical examination, etc. I think I just got to take every opportunity, like what we're doing now and what we do in the office, and then other things to kind of reach out to as many men as we can. I also kind of use my human side more openly out in the open, whether it's in the office or in things like this. I try not to have that stoic visual of a doctor that's, yes, you must do this, and I wear a white coat and have a stethoscope. I think if you see that, and that's why I said earlier, I'm a man too, man. I'm human. I have my own personal struggles, and when I share those, I feel like men are much more open to get the help. So I don't know how we're going to be able to get it done, but I do know it is possible, and we will get it done. It's just that journey, and the roadmap to that journey is still being laid out.
Yeah. One of the things that I would hear a lot from women when I had my procedure is, you men are all just babies. Imagine how we feel every time we go for our pap smear or all the C-sections and everything. And for me personally, it really solidified the fact that women are stronger than men.
Yeah, but not all women are like that. They're not, as some may, some won't. But I think it's kind of like their way of saying, man up. You can do this, right? And some of us need it nice and soft, and some of us need it just like straight to the fact, like, hey, this is the case. And perspective is very important. When you see what a certain gender or certain individual has been through, then you're like, all right, yeah, okay, I can handle this. But not everyone is able to, what would have worked for you and how it was said may not work for someone else. Like for someone else, it may deter them. Like, yeah, screw this. Like, I don't want to hear this. So it's kind of like every man's not the same. You can't just put them all in one bucket. Yeah. And every female is not the same. And there's people that have no gender. So or choose not to, personify as male versus female. So we live in a world where you have to kind of individualize everything. And it comes, at least for me, in my office, I spend the first 5 minutes just getting to know the patient and trying to figure out, okay, which personality trait are they? How am I going to be able to get into their psyche and get them to buy into what they need for their health? So I think you got to be a good reader of people to really get that message across. So be careful when you kind of say things like this, is like, because not everyone's going to be receptive to it.
Yeah, that's the truth. Do you do sex transformation? I'm not even sure of the term, but gender transformations?
No, I do not. But we actually do have colleagues in the health system that are part of those processes.
Wow.
There's so much to do within urology that I choose to do general urology. I do some infertility on the male aspect and the chronic pain stuff, as I mentioned. Mm-hmm. And even that keeps me, so busy. It's like a 3-month wait to see me.
Wow.
There are people that choose to do that. It's just me. It's not what I've chosen to do. And I like doing some of these other things. So it's just, that's the great thing, is all urologists are not urologists. And that's why I remember I asked, like, it's okay to ask a doctor, like, how many of these have you done? Is this something you specialize in? Because you really want to go to someone that does something that you need all the time or is well versed in it, so that you're going to be able to get a good outcome.
Well, bro, I just want to tell you, I really appreciate you for coming out here, talking sweet with Sweet Baby J. You are the stallion. That's what we have to call you, the stallion.
Well, I'm a urologist, man. So if you're not a stallion, there's ways we can help you become a stallion.
I like it.
Urologists, people think all we do is kidney stones or resume, because you mentioned so many times, but we also do erectile dysfunction, low testosterone. We do kidney stones. We do removals of the prostate for cancer. We do, when people have kinks or blockages, when people have kinks or blockages in their kidney tubes, testicular cancer, like swelling around the balls. Like, we do so many things, man. So, we definitely are, we do a lot of things. So we're always here for you, and I appreciate the conversation. And, go find a doctor that you mesh with or gel with. You will see, like, we're here to get you better.
You mentioned something just now, and it made me want to just have a little bit more conversation with you. When it comes to erectile,
that's going to charge you extra.
When it comes to erectile dysfunction, ED, what type of options are out there for men, and has technology changed with that?
Honestly, technology has not changed much. There's 5 major options. One is lose some weight, get your other stuff in control. Number 2 is pills. These pills have actually all gotten very cheap because they're all generic now. So what used to be $40 a pill, now you can get for $1. Then there's injections to your penis. There's vacuum pumps and penile prosthetics. Now, there are some new things out there you may see kind of hit you up on Facebook with direct ads, or on the radio when you're listening to one of the streaming services. And those could include shockwave therapy for your penis, or even PRP or plasma injections. I'm going to tell you, man, there's a lot of things that men are being targeted for, but some of the newer stuff doesn't have much science behind it. And some people make a lot of money off these things. So if it sounds too good to be true, it's probably too good to be true. And if you're having to pay the equivalent of your month's mortgage for a treatment for erectile dysfunction, you're probably in the wrong place. Because there's a lot of these men's health clinics popping up, no pun intended. What I tell people is the best thing, which is the conservative thing, is go see your primary care doctor, go see a board certified urologist, and see what things are out there that you can do through your insurance or whatnot before you kind of jump into some of these exotic clinics, which my job is for your health. These other places, it may be for profit. So just be careful on getting sucked into anything that sounds too good to be true.
Thanks a lot, bro. I really appreciate you for the time.
That's about it.